Hi, this is just a message for all my music students and my history and English literature students and people that follow my chronic illness blog, just to explain why I've been absent for a few weeks, and that's because I had my right knee replaced. Now, that was because I have rheumatoid arthritis, and rheumatoid arthritis is not like osteoarthritis. It's not something that just happens with age where the bones just sort of wear away in the joints. This is where your immune system attacks the lining of your joint, the synovium, and you get what's called synovitis. And over a period of years, that kind of starts to eat through the synovium itself, but then the cartilage and the bone. And that's what happened in my right knee. So I had a total knee replacement on the 26th of September, 2022. And if you, like me, have rheumatoid arthritis, I'm going to give you my top tips for getting through it. I also have type 1 diabetes, which complicated things a bit. So I'll talk a little bit about that as well. Basically, you just don't want your joints to get to the point where they need replaced. And a lot of the biologic drugs that they have today actually stop that from happening. I've had rheumatoid arthritis since I was about 14 years old. So I've had it for 32 years. So in my case, it had already started before those drugs were even invented. So you might not get to the point where you need joint replacements. But if you do, and if you're anxious about it, I want to say it actually wasn't that bad. They give you a spinal anesthetic and a nerve block. And when the nerve block wears off and suddenly you can feel your knee, yes, it's very, very painful. And it's very painful for a good couple of weeks. They will send you home with Longtec, which is morphine. And then you'll be on like really powerful painkillers for at least 6 weeks. You probably won't be driving again if you're a driver for about 6 weeks. But I found the best way to get through the really painful phase was distraction. For example, I've always wanted to go to New Zealand, like that's my lifelong dream. So while it was really painful, I was looking at Lord of the Rings tours in New Zealand online. Just any little thing that you can do to like distract yourself, but especially if it's related to something that you really want to do in the future, it's just a good way to deal with the pain and, the kind of moods that come with the pain. Another thing that was really important that I had in place that made things so much easier was that my house was completely sorted before I ever had the surgery. I had raised toilet seats, I had a very high sofa, my bed is very high. I actually have a lift in my house, as in not a chair lift or a stair lift, but like an actual elevator, which made things really easy for me. Now, that might not be possible to do in your house, depending on where you live, but it's like, think about how you could cope with your house if you weren't very mobile. Like, if there's anything in the kitchen that you're going to need to lift, just have it sitting out for you when you come home. The clothes that you're going to wear, if you kind of leave those out over a chair or something, because you won't be able to move well enough to like get things out of drawers and like lift things out of wardrobes for a good few days. Maybe you're fortunate enough to have someone living with you who can help you with all that kind of stuff, but just having as much as you can done before the surgery really did help. And also, I want to talk about something that people get a bit freaked about, and that is the scar. Now, I'm not wearing the best clothing today to show you the scar, but I'm going to do it anyway. So that is the scar. It's not that bad. It will fade to be kind of silvery, and so there should be no reason why I don't go about wearing short dresses in future times. Now, this is the first of several surgeries I've got to have. I've already had a synovectomy and capsulotomy in my left elbow. That's as straight as my arm goes and it doesn't rotate, meaning that I don't play guitar very much anymore, but I do play the keyboard that you see behind me because I've kind of adapted. I also have a parlour guitar, a very small acoustic guitar, and it has a thinner neck, so I don't need to turn my arm as much. So if you do develop problems due to rheumatoid arthritis, there are things you can do to adapt and keep going with the things that you love. So at the moment, I'm going to be off work until the 14th of November. After the 14th of November, if there's any of your music that you want to send me, if you have any questions about the English literature course, I'm going to be back in circulation and answering questions and doing the things that I normally do from then on. And that's actually something that's kind of keeping me going, that I have a job that I really love and that I meet great people through it, and I'm sort of looking forward to getting back to it. I know it sounds mad And why wouldn't you just enjoy being off? But I've been watching Curvy Bride's Boutique, which I really love, and George Clark shows that there's only so much daytime TV that you can watch before you start to go totally nuts. So I'm really looking forward to like engaging with you all again. So I know it's kind of short and sweet, but that's my top tips for knee surgery, apart from one thing. And everybody says this, it may be painful, but do the exercises. And actually, if you can do exercises before you have the knee surgery, especially things like they call like static quad compressions, where you basically just squeeze the muscles slightly above your knee and very slightly lift your leg, that is going to mean that you're going in with those muscles as strong as they can be, and then your recovery is going to be quicker, because it can take up to a year to recover, because like they cut your muscle and they cut the nerves and all those things have to heal back up again. So if you're in the best place that you can be before the surgery, great, because I know it's like really painful. By the time I got my surgery done, I mean, this summer, before it was done, I couldn't even walk on the flat, you know. So even 4 weeks after surgery, I'm already better than I was before I had the surgery, which is just like completely amazing. Any questions about rheumatoid arthritis and knee surgery and that kind of thing, feel free to pop them below and I'd be more than happy to get into a chat with you. Always happy to meet people who have similar conditions. I said that I would mention the diabetes. Now, while I was in hospital, I didn't have a single normal blood sugar while I was in hospital. I was in for about 4 days, basically because they take away control from you, and they're not specialists in diabetes. So they were giving me some crazy ass doses of insulin. My blood sugars ran very high. I was actually happy to get home and get back in the saddle myself, and then my blood sugars really improved. But you will find that you need an awful lot more insulin, or you could find that after surgery if you're diabetic, because you know your body's had a major shock, which means that it will produce adrenaline. In my case, mine doesn't, because I'm steroid dependent, because I've been taking prednisolone for rheumatoid arthritis for a decade, which is not a good thing. But in most people's cases, your body will just be like flooded with stress hormones, and so your blood sugars will go high and you'll need a lot more insulin. And suddenly that passes out of your system and you might have hypos. And I found that I was on really, really high doses of insulin, and now I'm on the lowest dose of insulin that I've been on for quite a long time. And so like that's something to be prepared for. You have to keep in contact with your diabetes care team. It's like really important. And, you know, watching what you eat, as boring as it sounds, because you're not going to be mobile and you just don't want to like gain a whole lot of weight. I've gained a truckload of weight because I'm taking JAK inhibitors. I was so excited after surgery. I'd lost all this weight and I thought, yay! And then when I went back on the JAK inhibitors again, you know, just kind of piled back on, which is a bit depressing, but there you go. So that's really the story of my knee replacement journey so far. So if you're interested in chronic illness, or indeed in history, or in music and the music business, and especially in singing, then it would be really great if you subscribed, and I'll see you again in another video.